Hey everybody, welcome back to the Women's Clinic. Dr. Benac, we are Facebook Live today. We're going to talk about HPV. I've got my friend, or I guess not our friend, the HPV virus here. Just a diagram to show you guys. This is something that's been visited a lot on our Facebook page, and so I just wanted to go over a few things today and really wanted to invite you guys to write back to us with some questions. We want to know, what are your questions about HPV? We see you guys are going to the page and want more information about it, so we want to give you exactly what you need. But a couple quick pointers. So the HPV virus is something that's really, really important to us here at the clinic. HPV virus is a virus that in females can affect the lower genital tract. So that's most commonly your cervix. The skin of the vagina can also affect around the opening of the vagina as well. And it's gotten a lot of publicity because there is a very strong and direct link to cervical cancer. And so just a couple quick points about HPV. So there's 200 different types of HPV, which is crazy. This model here has 200 different proteins on it. I put exactly 200 pins onto that model. So think about it, that's a ton of different types of HPV, but there's 15 that we really care about. And there's 15 cancer-causing types, and of those 15, there's 2 or 3 that we really, really care about. And those are things that we're checking for on your pap smears when you come see us at the clinic. HPV is common. It's a question we get a lot. If you look at any point in time, right now, about 40% of women around the world have been infected or are currently infected with HPV, so it's super common. Around 80% of women at some point in their life will be affected. So why are those two numbers different? Well, the good news is your body, just like it would fight a cold virus, can fight off the HPV virus at times. And so, especially in our younger patients, many times that will happen. Within 1 to 3 years, your body's immune system can fight off the HPV virus. Now, you can get reinfected. Sometimes the infection can come back and reactivate. And so that's why repeat testing and regular pap smears is so important. But just because you've been diagnosed with HPV does not always mean that you're a carrier, but it does mean that you need very close follow-up with your OBGYN. I like to think of it like high blood pressure. So high blood pressure can be a warning sign. It can cause problems with your heart. It can cause things like stroke. And so we watch and monitor people with high blood pressure. HPV is very similar. Somebody with a positive HPV test on their pap smear, which is usually how we're going to find it, needs to be monitored and needs close follow-up. And so talk to your doctor about those things. Sometimes we do pap smears every year, sometimes every 3 years, every 5 years. It depends on your age, and it depends on what your pap smear result is. Real quickly, I want to give you 3 practical tips that can help you when thinking about HPV. So what can you do to prevent HPV vaccine or decreases your risk of being affected by it? So number 1, get regular pap smears. Super important. We talked about the time interval for those being different based on your age, and follow your doctor's instructions. Where I see people run into problems with HPV and cervical cancer is when they go long periods of time, 5 years, 10 years. They allow time for viruses like HPV to affect the cervix, cause precancerous changes, which lead to cancerous changes. And that is something we really want to avoid. So please, please, please come for your regular scheduled appointments, come for your pap smears. Number 2, stop smoking. So if you are a smoker or tobacco user, Juul, or any type of nicotine at all, we know that tobacco and nicotine products suppress the immune system, and it makes it more difficult for your body to fight off and clear the HPV virus. And so increases the chance or the likelihood that you might have problems with the HPV virus causing precancerous changes that could lead to cancerous changes. And then last thing, consider getting the HPV vaccine. So this is something that has gotten a lot of publicity again recently. So HPV vaccine was cleared by the FDA in, I believe, 2001 or 2006, but it's been approved for a long time now for any patient, male or female, aged 9 to 26. And what we know is when you get the HPV vaccine, it protects you against some of the most dangerous types of HPV that can affect cervical cancer, and it decreases your chances by 99% of being affected by those types. So it's super, super effective. Even if you've been affected, we recommend the HPV vaccine to prevent infection with new types or new types of HPV down the road. And so please consider that. Recently, the FDA has approved this vaccine up for patients to the age of 45. And so if you're between the ages of 26 and 45, still consider getting vaccinated. Make sure to check with your insurance though first, because insurances are still in the process of adjusting to this new recommendation. So that's all I've got for today. HPV is something that's important to us here at the clinic. We'd love to talk to you about it. If you have questions, we are going to post an anonymous or a link to an anonymous question form. You can submit a form. I'm going to take 3 to 5 questions here in the next week or two. I would love to answer the questions that you guys have to get you the information that you need. Hey, it's been great hanging out with you. Have a great day. We'll see you soon. Bye.